Welcome, sir. बाजार खाली, सड़कें सूनी, मोहल्ले वीरान हैं। खौफ बरपा है, हर तरफ लोग हैरान हैं। ये वो कहर है जो दुनिया को डराने आया। ये वो कहर है जो दुनिया को डराने आया, मगर ना समझ है जो इंसान को हराने आया। इतिहास गवाह है ये मसला भी सुलझ जाएगा। इतिहास गवाह है ये मसला भी सुलझ जाएगा। जिंदा रहने का ये जो जज्बा है, गुम हुआ है, टूटा नहीं। जिंदा रहने का ये जो जज्बा है, गुम हुआ है, टूटा नहीं। यही जज्बा फिर असर लाएगा, फिर उबर आएगा। मुश्किल बहुत है, मगर वक्त ही तो है। गुजर जाएगा, गुजर जाएगा। A very cheerful morning to you all, respected teachers, guests, and friends. Today is a very special day. Today we are honored to have a very esteemed guest, Dr. Kimniyat Waifi ma'am, who is serving in the Department of Psychiatric Social Work, NIMHANS, Bengaluru. She would be talking to us about a subject that interests us all and needs to be addressed urgently: how to cope up with grief as well as loss in the aftermath of COVID-19. Now, my request our convener, Vanna Joshi ma'am, to please come on the virtual stage. Her knowledge and experience has been gently guiding us through these months of learning and executing the MGNCRE scheme at SVC. She would now tell us about the MGNCRE scheme and the various team activities we have been conducting.
Thank you very much, Madhur. Principal ma'am is trying to join and she'll be with us soon. I welcome Ms. Neha Dagar, who is with us from MGNCRE. And I extend a very warm welcome to students and colleagues, and also our esteemed speaker of today, Dr. Vaipai. It's with great pleasure that we want to greet you all on behalf of the team to this webinar on coping with grief and loss in the aftermath of COVID-19. This webinar is part of the activities that we have been conducting in the past few months under the Swachhata scheme of MGNCRE. The MGNCRE, or Mahatma Gandhi National Council of Rural Education, approached Madam Professor Reddy in early July this year to set up a COVID helpers team to offer psychosocial support in the wake of the second wave of COVID-19. A workshop was conducted in mid-June by Ms. Neha Dagar, who's with us, as I said, our resource person, to initiate the project. An enthusiastic team of NSS volunteers stepped forward to take the challenge, and ever since then, we've been filing fortnightly reports with them. Apart from conducting the routine distribution drives of food and essential items, the volunteers started a new initiative called Pahel. Pahel focused on vaccination awareness and registration. The team first conducted a survey at Sanjay Camp, located in the neighborhood of SVC, on vaccination hesitancy, vaccination awareness, and vaccination availability. They then set out to help the respondents with obtaining their Aadhaar cards first, and then with vaccination registrations. The second initiative focused on emotional and psychological support to the survivors. Under the motto, each one, reach one, our volunteers approach one specific respondent at a time in the age group of 18 to 40. They persuaded the respondents to talk while they listened, observed, and allowed them to take lead in the conversation. The respondents gradually opened up to the interviewers and talked about grief and loss, low self-esteem, suicidal thoughts, opportunistic attitudes, and starting afresh. One of them said, and I quote, "While it is important to win, it is even more important to remain undefeated." End of quote. This motto gave the respondent the hope and potential to fight till the very end. And with this positive and happy attitude towards illness, she feels much better and is recovering faster. Another one said, and I quote, "I realized that sometimes taking responsibility in sticky situations toughens us up, and the only thing we can do at that time is just keep swimming." End of quote. Through this exercise, the volunteers realized how important it was to listen to people and make them feel they have someone by their side. As the tide ebbed, it left most of us physically exhausted, mentally distressed, and in need of emotional support. This pandemic brought along with it unforeseen fear, phobia, stigma, ostracization, and a host of negative emotions. Patients, long after leaving their sick bed, were reluctant to talk about their experience and feelings. We commend our team of volunteers for fighting the challenges they faced in initiating these conversations and bringing the respondents out of their isolation, depression, and despair by carrying out long conversations with them. We commend them for forging bonds of solidarity and trust with their respondents. We salute their contagious spirit of caring and sharing and pray that their infectious smiles continue to lift sinking morale of the traumatized who are still combating the after effects of this deadly pandemic. While we work towards comforting the survivors and their kin, we were acutely aware of the need of a professional who could counsel helpers and survivors alike. Someone who could help us in breaking the psychological barrier that stands between helpers and respondents. To this purpose, we have today among us Dr. Kim Bai Pai, who has been working with COVID patients, survivors, and their families for a long time. A very warm welcome to you, madam, once again. I hope the session will be truly interactive. We will invite responses, observations, and queries from the audiences. So please stay till the end of the session and participate in the discussion. Let's break down the barrier of speech in what promises to be a truly rewarding session. Thank you very much indeed once again, and welcome to you all.
Thank you so much, ma'am. This is so wonderful, motivating, and insightful. And that line, while it is important to win, it is more important to remain undefeated. Honestly, touched us, ma'am. Thank you so much. Has Principal ma'am arrived?
Doesn't look like it, huh?
Okay. So I'll call her later. विकल्प मिलेंगे बहुत मार्ग भटकाने के लिए, विकल्प मिलेंगे बहुत मार्ग भटकाने के लिए, मगर दोस्तों संकल्प एक ही काफी है मंजिल तक जाने के लिए, संकल्प एक ही काफी है मंजिल तक जाने के लिए. Now we request our very supportive co-convener Mr. Howcome Wi-Fi to introduce today's speaker to us. Howcome sir, due to his dedication, wholehearted efforts and sweetness, made himself an instant favorite of our group. Sir, could you please come on the virtual podium and introduce the speaker?
Good morning, everyone. Respected Principal Ma'am, Dr. Vandana Joshi, Convener, Ma'am Neha Dagar from MGNCRE, teaching and non-teaching staff of Sri Venkateswara College, students, community, and also everyone present here. So it is a great pleasure for me to introduce a speaker today who is going to talk to us about coping with grief and loss in the aftermath of COVID-19. It is a topic that concerns us all. Indeed, assuring sound mental health is the biggest challenge that humanity is facing today. And we are humbled today to be having by our side an experienced counselor, Dr. Kimnei-Had Vaipe, who will share her experiences with us in her speech. She is currently an assistant professor, Department of Psychiatric Social Work, and consultant, Nimhans, Bengaluru. She had presented papers in several national and international conferences. She published several articles nationally and internationally and received several fellowships, such as in ICMR and also Young Research Scholarship Award at Stockholm 2012. Since COVID-19 pandemic, she worked tirelessly to help COVID-19 patients and also create awareness among public. Currently, she is working on various projects related to mental health under the Ministry of Women and Child Development, Cardiff University, UNICEF, ICSSR, and also non-funded voluntary projects. Ma'am, we look forward to hearing from you. Please join me in welcoming Dr. Kimnei-Had Vaipe.
Thank you so much for the warm introduction, Dr. Howcome. And a very good morning to everyone present here today. It's a great honor and privilege to be here. And first of all, I would like to thank Principal Professor Reddy and the quite enthusiastic and quite promising convener we have today, Dr. Vandana Joshi, and the co-convener, Dr. Howcome, and also the MGNR and CRE staff. So thank you all for having me here. And also at the outset, I would like to congratulate the management, principal, the teaching faculty, staff, students of Sri Venkateswara College on the celebration of Diamond Jubilee of your esteemed college. My best wishes, and may you continue to flourish all time in the time to come. So coming to the presentation for today, I'm very happy to learn from Dr. Vandana that you have taken up a project, and my appreciation to all the young volunteers who have taken up this cause to help people who are in distress during the pandemic and the aftermath of pandemic. I really appreciate the work that you do, and because this is the need of an hour, and reaching out people who are quite distressed, or who have their own concern, it's really appreciable. Okay, and now coming to today's topic, let me try to share my PPT before that. So we will be talking about coping with grief and loss in the aftermath of COVID-19. And this is the content for today's talk. So let's try to understand the nature of grief, the complexities of grief, pandemic and grief during this COVID pandemic, and the common grief reaction that we usually go through, and how do we cope with grief or loss that has strike us during this pandemic period. So coming to an understanding of grief, grief and loss, as we all know, are universal. As we are born, we are expected to face this at an earlier phase or later phase in life, and it's quite inevitable part of our life. And grief is something which is painful, which is quite difficult for any humankind, and to understand what grief is about, it's a normal and reaction and natural reaction to loss. Okay, so these loss can be a loss of a human, a loss of a loved ones, or it can be a non-death loss during a pandemic. Like, as we all know that there was a total shutdown, many of us were kept inside the house, whether we wanted it or not, so many changes have taken place during the pandemic. We are not able to go out. We are no longer able to socialize with our friends or our colleagues, and we are no longer able to follow certain routines. So this pandemic has had a great impact on our lives. Okay, so both in terms of loss of loved ones, as well as a loss of many other things. So though we say that grief is a universal thing which everyone is bound to face one day or the other, the way we grieve, or the way we and the way our grief would be entirely different. Even amongst a family, if you see, you might have seen someone who is quite okay after a few days, but some of the family members would be still crying, or being not able to function like before, and not able to do certain tasks which needs to be carried out. So it's intensely personal, the way I grieve differ from the way other people grieve. So, and it's not a linear procedure. You know, there is no timeline in grief that after a few weeks or after a few months, you'll be perfectly okay. There is no such thing in grief, you know. So, and it's not like you can have your grieving period for a few days, pack it, tie it, and then keep it aside. It is never going to be that way. You know, it's not a linear procedure, does not follow a standard timeline. Initial days, it would be quite intense. Even later in life, you know, during the anniversary of the dead one or your loved ones, you might feel an intense pain again. So it does not follow a timeline. And what we need to understand about grief is that we cannot take away the pain, you know, or stop the pain. And we should not, as a counselor or as a helping professionals, you know, we cannot take or should not take away the pain, as pain is one of the more important aspect of grief. You know, we have to go through the pain. We have to you know, feel what is coming with us, the feelings, the emotions that we go through, because there are certain emotions that strike us when we grieve. You know, we can be angry, we can be upset, we can be distressed, or we can be extremely sad. You know, these are the reactions that we usually have, the emotions or the feelings that we usually have. And it's quite normal to have those. Okay, so we should not encourage or we should not suppress our pain or try to stop the pain. Rather, take it as it comes. Okay, I'll explain to you this a little more in the later slide. And coming to the complexities of grief, so grief is universal, but expressions and rituals are culturally mediated. So if we look at it, each culture, each different part of the country or each region have their own way of grieving. You know, some appreciate a silent or a very private kind of grieving. Some accept a louder one, or you say crying is acceptable in some place where the other would not appreciate someone crying, telling them that, you know, you should not cry during this period, you should hold, you have to take care of certain people, you should not cry, you know, what will the deceased feel seeing you cry like this. So it's the expressions and rituals are different in each culture. Okay, so that's something which is very, very important. And during this pandemic, all these rituals, all these cultural traditions for death that we have, the funerals, the grieving process, the condolences, you know, it has turned upside down. You know, we are unable to gather together. We are unable to be by the side of the loved one, especially when they were tested COVID positive. You know, you can't be near them. You can't be going um, to the hospital for a visit. You know, everything is being restricted during this period. So grieving during this pandemic time is quite intense, and it can be quite traumatic for many of us, because the process that we go through is quite intense. And the other thing which is important to know in grief is that individuals grieve differently. You know, as I told you, even when in the family itself, there might be someone who would be quite, um, you know, quite sad, quite, you know, low, or not able to do certain things which are which needs to be done at that point of time. You know, and when the other family members does not recognize or fail to understand, or, you know, does not appreciate those, it can be quite distressing for the person, for the individual. You know, and there could be a whole sense of isolation or loneliness in that person. And the other complexities of grief during COVID is that the elders would be grieving. You know, they have their own process of grieving, and the children would not be paid much attention. because they are so overwhelmed with the loss that is occurring in their life. So children are at times being not attended as it should be. So these are some of the complexities that we see in grieving, during this pandemic period. And as we all know, that COVID has impacted our lives in many ways. So it's not only the loss of the life that we have come across, but there has been a drastic change in our normal routine, a sense of loss of control. Your routine has been um, compromised, or your sense of being comfort going out in a weekend with your friends, or being a part of some community program, or anything, your socialization, that has all been compromised. So grief can happen in response to many of this, not just the loss of life ones, but due to the other many things. So the losses, if we look during pandemic, we have lost our loved ones. If it's not the family members, but we also have lost, many of us have lost our friends, our colleagues, our neighbors, our leaders, our faculty members, or the one in the college. And we have also seen people losing both the parents or children during this period of time. So loss of loved one is something which strike us during the second pandemic, second wave of the pandemic. And we also have lost the freedom of movement, the freedom of like moving around to places, commuting to our colleges or to other place of interest, and our routine, the community contact, which is very, very important for us as a human. The social support or the social interaction has diminished. We can't have a face-to-face conversation. We can't have a dinner together. So those have been compromised, and even the physical contact. So the COVID stands like you have to stay 2 feet apart from each other. You should not, many should not stay in one place together. So these are the thing that has been told to us repeatedly. So we have lost our physical contacts, and many which you have might have come across while dealing with the community, that we have also lost many things in terms of the financial aspect. Many have lost our employment, our job, or many have had a half pay. So there has been a huge financial difficulties during this period, and medical access was very, very difficult during a period of time. Even when you are sick, you really have to think multiple times whether to go to the hospital, or even if you go, whether uh, you'll be able to easily access to the medical staff. So these were some of the things which we lost. And the other important thing that we lost was the sense of control, the control over yourself, or the things which you have previously so these are some of the things that we lost during the pandemic. And grief during this time is an intense and traumatic experience. you know and why is it so that it has been a rough journey for someone who has lost a loved ones due to COVID or even non-COVID death? So initially, what happened to us was that there were no beds in the hospital. Even there were no oxygen, no enough oxygen, no medicines at time. And when the person is tested positive, then there is no other option. You have to leave your loved ones in the hospital alone. You can't be with them. You're not able to communicate with them the way you would wanted it to be, or in a normal situation. So and there could be a lot of sense of guilt in many of us for not being able to be there in times of need for your loved ones. And many could not participate in the normal rituals because there have been a protocol laid down, or you might be in different cities or different part of the country, so not able to say goodbye. So these are some of the things which makes us feel, a whole lot of feeling being helpless, or powerless, or not being feeling guilty, so this has become a really rough journey during this pandemic. So coming to some of the grief reaction. So when we talk about when we grieve, what happened to us, so each of us react differently, but this is some of the common understanding that we have seen or come across in the literature, that, we can be shocked, disbelief, or in denial, not able to accept the fact that your loved one has left you. So it could be quite overwhelming. And also there is a difficulty in concentrating on focusing on the tasks, so you're so overwhelmed with so many things that there is a difficulty in concentrating or focusing on certain activities that you are doing on your daily day-to-day life. And there can be bouts of anxiety, a whole lot of worries, a whole lot of um, restlessness, palpitations, or it can be, feeling quite at the edge. Okay. And it's quite distressing, can feel very distressed. And anger to self for not doing certain things, blaming oneself, or anger to the person we live with, the family members, or even anger could be with the system, why, with the hospital staff, or with the system, or with the community itself, why people are behaving this way, or why this is not being given at that point of time, so a whole lot of anger can happen during grief. And periods of sadness where you feel intensely sad, you feel lost, you feel um, helpless, you feel hopeless, and you started um, mistrusting people, or the community, or the world, and there could be a lot of changes in your sleep pattern, disturbed sleep, lots of nightmares, or not able to sleep enough, or being restless, or there could be a changes in appetite where you don't feel like eating, you don't feel pleasure in eating. Okay. And there can be also a memories and thoughts about who and what has been lost. So repeated thoughts about the disease. Okay. Yearning or longing for the person. So, and the other thing is withdrawal from the usual activities. You don't feel like, even the self-care could be compromised. You don't feel like bathing, you don't feel like going for a walk, you don't feel like doing certain tasks which you have been normally doing it. So, or trying to seclude yourself from people, not wanting to talk to your friends or your family members, so withdrawing behavior are also quite common during grief. To understand more in larger manner, so how do we when we react, what all gets affected? One is the thought process, so difficulty concentrating, there could be an increase of dreams, or there would be repeated dreams about the disease or what was been going on around at that point of time. You can be quite detached from your surroundings. And coming to your behavioral reaction, you can feel numb, disoriented, not in the moment. Okay. And lots of blaming behavior can also also happen, that why I should have done this, it's my fault, when So it's not really your fault, you tend to blame yourself, or searching or yearning or longing for the person, or the loved ones. And we can also feel a whole lot of emotions, like you feel empty, you feel lonely, you feel quite hopeless about what is going on around, and feels that things are never going to be the same again, or feel really helpless in the situation, and also a feeling of bitterness. Okay. And not only our emotions or our thought process, even it can manifest in our physical reaction. Okay. Like there would be difficulty sleeping, there would be change in your appetite, there can be, loss of energy, that you don't feel, you feel tired most of the time, you don't feel energetic at all. And there can be numbness, there can be palpitations, sometimes difficulty in breathing, and also quite hyper vigilant about the noise or the sound which is going on around. Okay. So, and a lot of exhaustion. So, apart from all these things, we also um, questions a lot during the grieving process. Where is God? Why is God not helping me at this point of time? Is God really there? So sometimes we lost hope in our faith, or started questioning about our belief system, or there would be lots of confusion taking place. So these are some of the common reactions. And as I told you, each person react differently while grieving. So these are some of the common grief reaction that usually happens, that takes place when someone lost a loved ones. Okay. Just to understand this, I've adopted this from Elizabeth Kubler-Ross on the stages of grief. As I told you, it's not grief process doesn't happen in a linear way. Sometimes you can feel intense about certain thing, and then there would be at times when you feel okay, and that intense emotions can strike in again at some point of time. So, but this for a common understanding of what is the stages that people can go through, while grieving. Okay. So initial stage would be, we can be in shock or in denial, hoping that the news is incorrect, or that you are totally in disbelief of what is happening around you. You'll be shocked. You'll not be ready to accept the fact that it's the person is no longer there. Then after that, what happened is that we can have an intense pain, of intense pain, and a feeling of guilt, where you'll start blaming yourself for not doing what should have been done. I could have taken him to a better hospital, or we could have gone a little earlier, or I could have told this to him about how I feel about the person. So many things can come into our mind. Okay. So then we can also feel angry, as I've told earlier, and bargaining with God, like, why me? Why life is not fair? Why, where is God? So this kind of thing can strike us too. And there could be an period of extreme sadness. If you feel pain, you feel quite low, you feel terrible, you feel quite you know not able to take what is going on around. Okay, so you can be tearful, you can be sad, can be quite distressed at this point of time. And next is the upward turn, when life becomes calmer. As time goes on, the intensity to some extent would have come down, and you will be a little more calmer and a little more organized. Then in the initial or the acute phase of grief, you know. So, and you might start working through this, trying to become more functional, trying to take up, um, initiating, taking up your routines or your activities, okay, and trying to look at more realistic thing, okay. Then the last is acceptance and hope, where there is where the power lies. You know, you try to accept that, okay, the loss has happened, but I need to go on with life. But as I told you again, this does not happen in a linear way. You know, it can strike you, it's like a spiral. It can come back at any point of time, even after a few months or after a few years, during the death anniversary, or listening to the person's favorite song, or some of the things, the belonging, seeing the belongings of the person who has deceased. Okay, so these kind of reaction or feelings can come again and again, and we need to prepare for that, and that is quite normal. Okay, to have those reactions are quite normal. And sometimes what we do is that we tend to blame ourselves for not getting over the grief, okay, which is very wrong, okay, because these are a normal process, and all the most during pandemic situation, you know, where we live in a very abnormal situation. So this can be quite intense and it can be quite traumatic. And the other thing is that there is something called this enfranchised grief, where your grief is not acknowledged by others or by the society. Like, you know, in the time of pandemic, many have lost many things. Either it's in terms of debt or an non-debt loss. Okay, so many people are overwhelmed with their own problems or their issues. So the one who grieve rarely has an opportunity to seek help. Even when trying to seek help, would look at the other person, then they might have their own uh, bouts of problems which is going on, you know, and you don't feel really good to share your emotions with them, you know. So sometimes your pain, your grief, your problems are unrecognized, and at those time it can be quite distressing for the person, and it will give you a feeling of loneliness, or uh, feeling being alienated, okay, at times. So handling grief and becomes very important. So looking at the grieving process, as told, it's highly individual experience. The grief process differs from one person to another. Some can take a little longer time. Some are quite okay in few weeks or in few months. Okay, but some goes tend to take a little longer time, and it's quietly okay to feel it that way. And what we need to know is that there is no right or one way to grieve. You know, each person has different way of grieving. Okay, so there is no right way, or there is no one way that everyone has to go through this process and then the grief will be over. No, so there is no one way to grieve. And what we do need to understand is that it takes time and it happens gradually. You know, the process takes time, and it has to go on gradually. Okay, and during pandemic, as we all know, it's quite isolating, that we don't have the support system around us, we don't have much people around us to console us or to talk uh, about our feelings, you know, or you can't really be there for the funeral or for the last rites of the loved ones. So it will be hard and it's going to hurt. So whatever your grief experience, it's important to be patient with yourself and allow the process to naturally unfold. So give yourself time, let it naturally unfold. And the most important thing which we need to know while grieving feelings, just let it, just take it as it comes. And what works for whom? So as we know that many of us have significant internal and external resources within ourselves, and with the support that we do get from our family, our friends, or from the community, and we have resources and capacities, even though we are highly distressed and grieving, so these people might not need a clinical support, like it's not a psychiatric condition, okay, so but would respond well to guidance, a support, or referral to any support groups or resources, at that point of time. And how do we cope with the loss of loved ones? One is to acknowledge that grieving during this time is more difficult than coping with a loss outside of the pandemic. So it's better to acknowledge that it's not going to be easy. It's going to be difficult than in the normal times. Okay. And the other thing is to give ourselves time to be gentle with ourselves, and to heal at our own pace, because there is no right time for grief. Okay, it's going to be a long process. So, and the other important thing is not never compare yourself to another grieving person, even in the family. Some family members would have dealt with it quite efficiently and would have been able to normalize their routine earlier than you. Okay, but never compare yourself with them, because each one of us have our own timing. Okay, and to remember that there is no quick fix in grieving. It's a process and it's going to take time. Okay, and the other important thing is try not to isolate yourself, because during the grief period, sometimes we feel like staying alone, not willing to talk to person, just inside your room and be yourself. So at times, in few occasions it helps, but in the long run it doesn't really help. Okay, so trying not to isolate yourself, stay connected. The reason being, when we try expressing our concern to other people, it really de-stress ourselves. It's a very Okay, so it really de-stress ourselves. It helps us in relieving our stress process, in our stress. Okay, so at times it might not be quite feasible to go and see the person in person, but it's always wise to use technology that we have. Sometimes if you're quite okay for a video chat with your family members, you can have a video group calls, which is quite, and talking and sharing about your experiences, that would be quite helpful. Or over a phone, talking to them, routinely, would really help us in the process of grieving. And yes, healing does not occur in a smooth line or on a timetable. So it occurs in phases where you move in and out of different feelings. So sometimes you might feel okay for a moment, but sometimes you might feel really in pain, or you might feel like crying. So remind yourself that you can get through this. Okay, so there can be like escalation of emotions at certain point of time. Be okay with that, and when that happens, it's okay to to feel it that way and remind yourself that you can get through this process. Okay. And as far as possible, while even in our grieving process or in our bereavement, it's always good to alternate between loss and restorative activities. So what I mean by this is that uh, you have every right to grieve. You can grieve, um, so whenever you feel like crying, you can do that. You can be honest with your feelings and your emotions. Okay. And also keeping in mind to take out time, um, to be mindful and to take a time out for yourself, so as to rejuvenate yourself, or in a restorative activities like a simple walk around the lawn or in the apartment or wherever, or in the campus, for 10-15 minutes a day, or doing something, watering your plants, or trying to do certain things of your hobbies which you have enjoyed previously, as sketching or drawing or painting or whatever it is. So at least taking a time out for those restorative activities would be helpful. And during the process of grieving, expect relapses. So there will always be certain things that trigger sadness again. And this is quite normal, you know. So sometimes his favorite music is being played, or you have gone and visit the places where you have frequently visited to with the person whom you have lost, or visiting or certain other activities that you would have done together. So that can remind you of the person, and that can trigger the sadness again, but that is quite normal. Okay. And also to develop new rituals to cope with the loss. So as far as possible, trying to take a step. Sometimes it can be, forcing ourselves, or trying to initiate to boost up ourselves and take up something which we can do to cope up with the loss. And some of the people whom we have seen have shared their experiences that, sometimes they get involved in helping the person in need, and that has given them intense happiness. Okay. And doing something in the name of the disease, or the person you lost can also help, is what they have narrated. Okay. So, and doing something like writing or jotting down your thought process, or doing something which would be helping you in, feeling, making yourself feel better. So developing those rituals would be really helpful. And make plans to help you feel more in control. And being in a routine makes us feel more in control. So uh, try to have a routine which you regularly follow, and and schedule it, so that will really help you feel more in control of the situation of yourself. And the other thing is to balance our thoughts, because there can be lots of thoughts coming in our mind. There can be lots of blaming things, or guilt stricken things that comes into our mind, or being angry at many people or many things. So handling our thoughts would be something which we can do actively. Okay. For example, trying to uh, take a pause and think, uh, take trying to take a pause and look into the thought process that we are going through. Am I unnecessarily worrying about certain things? Okay. Or rechecking what is going on. So these can help us be more realistic. Okay. Then rather worrying about unnecessary things, or worrying about something which are much beyond our control. Okay. And being mindful, staying at present, at times you might feel terrible, you might feel at loss, you might feel quite um, restless at the moment, with things going on around. So trying to be mindful, be present at the moment, and also to calm oneself down. Breathing exercise do help. Okay. So practicing some breathing exercises, trying to be mindful at the moment. So these are some of the things which help us in times of distress. And the most important thing which we need to focus in times of pandemic is our self-care. Sometimes we overlooked into it, or we neglect the self-care, which is very, very detrimental to our well-being. Okay. So trying to take a pause, trying to sleep as much as we could, trying to do some physical activities which could help us feel better, or trying to take a time out for yourself to do certain things which you feel good about it. So these are some of the things that we can do um, in this distress situation. And the other important thing is to disconnect from social media or news if it's affecting you. Okay. Because during the grief period, in the process, we might have heard of many people in the community, or the news of the dead one. So that can really have an impact on us again and again. Okay. So it's okay to avoid news, or to disconnect from social media if it's affecting you. So that's some of the things that we can do while dealing with loss and grief. And just to add on this, many of us, grieving, um, we at some point of time tend to overcome it, and we have in the process of grieving, we tend to successfully attempt, or successfully accept the fact that we have lost someone, and we are quite okay with it. But a few people, a few, about 10% of the person who grieve would have a difficult time for a longer period of time, so not able to um, complete their daily activities, or not able to come out of the grieving process, still remain in the acute phases of grieving for a longer period of time. So, so in case if those are there, they might need extra help and support. And also if there is an increase in your depressive symptoms, like you don't feel good about it, you feel sad most of the time, you're unable to feel happy, you're unable to do certain aspect of your regime, or your sleep has been drastically disturbed, and you're not able to concentrate, focus on the daily routine that you have, or you have some anxiety symptoms like being fearful, being constantly worrying about it, or some physical symptoms of anxiety, like you have quite often as these palpitations, breathlessness, and all those things, then you might need an extra help or support. And if your way of coping is of using drugs or substances or alcohol, and that has really increased, then you might need an extra help. And if there are any death wishes, you feel that you feel quite hopeless, you feel quite helpless at the moment, and you feel uh, quite often you have a thoughts about harming yourself, then it's always good, help is available, and it's always good to get support from our professionals. So to end the thing, this is a quote from one of the, I mean, a saying from one of the psychologists, which I have read through. So what he or she say, what she told is that despite the losses, despite um, 1 second, despite the losses, despite the pain, there is a light at the end of the tunnel. We are resilient, and we know that connecting to one another can the decrease the pain and loneliness we may be experiencing. So it's okay to get help if we feel that we are too overwhelmed with our own feelings, and and help is available. Okay, so this end my presentation. I will hand over the to the convener again.
Thank you. Thank you so much, ma'am. Ma'am, we can't explain how interesting, encouraging it was to listen to your kind words. We absolutely loved it. You made us aware of so many things that did not cross our minds earlier. And the way you described grief, the way you told the stages of grief, and how you concluded with a positive message is all wonderful, ma'am. Thank you so much. Ladies and gentlemen, every session is incomplete without an interesting question answer session. Therefore, I request a very lovely audience to feel free and ask all their doubts and queries. We would be more grateful if you all use chat box instead of your microphones. You all can type your queries. While everyone is typing, ma'am, I wanted to ask something. Uh, Ma'am, usually it is seen that yoga is the solution to most of the problems. And but the youth of today's society prefer to do other things, like they would go to gym, they would eat anything that would increase their health, improve their health, but they won't do yoga, which is also equally necessary. How can we inculcate the habit of practicing yoga on daily basis?
It's a very interesting question. Okay, so yes, yoga do help. We also have a yoga center at Nimhans, where we have been, allowing a patient with um, mental health issues to take as an add-on, not as a main therapy, but as an add-on therapy, and it do works wonder for many of the client. Okay, so, but what is important to remember is that each one of us deal with our problem differently. And the way we cope up, the coping strategies that we use differ from each other. For example, some people find it good to listen to music. They feel calm while listening to music. Some people love nature. So walking around helps them calm better. Okay. Or some people doing yoga, or sometimes going hitting a gym can really help you feel more better. Okay, so each one of us are unique, and there is a different way of uh, handling our problems. So what it's good to one person might not be the same for the other person. So that's something which we need to keep in mind. But yes, yoga do help because it's meditation, breathing exercises, being aware of where you are, being at the moment, being mindful. These are some of the strategies that really help us in dealing with our distress. I hope I answered, Madhur.
Thank you so much, ma'am. This is very nicely answered, ma'am. Thank you so much. Ma'am, we have a lot of questions coming up. Ma'am, it's been happening with me. The other person is saying it's been happening with me from a very long time that in the morning suddenly I feel so restless and my anxiety reaches at the level that I have to go up to bed immediately and start doing something or the other thing. Even during the day, sometimes my anxiety doesn't let me sit peacefully at a place. I tried meditation, but in this state, I can't focus on it either. So, what's the way out? Please help.
Okay. Yes, I think as she pointed out that the meditation is one of the thing that we usually, being mindful, being doing during, doing breathing exercises. These are some of the things that we usually encourage our client to do it when they are quite anxious. Okay, so if this anxiety prolongs and if it's there for a longer period of time, I would, and it's quite distressing and it has been affecting your daily routine, then I would suggest you to meet one of the mental health professionals so that they will have an evaluation or assessment of your problem, and they would be able to give you proper guidance on how to help you better. So I think that would be the suggestions I would want to give, because you have tried on your own, you have tried doing certain things to calm down with your anxiety, so but if it's quite distressing and it has been there and affecting your day-to-day activities, then I would really suggest you to meet one of the mental health professionals so as to guide you better in dealing with your anxiety.
Thank you so much, ma'am. Another question by Nandini Sharma. Sometimes when our parents share their anxieties and emotional stress with us to find solutions, what should be our approach and response be in such situations? How do I help them overcome their problems and teach them to delusion from the emotional suppression with which they grew up if they share them with us?
Most of the time when someone share their emotional problems or the distress, or the concern, so the first stand what we usually do as a counselor is, one is to listen to them, because sometimes what we understand is that many of them just wanted to vent out their emotions. They would not need direction, or they would not need much advice from your end, but that venting itself makes them feel much much better. So if someone is sharing um, their emotions, then it's always good to listen to them, to try to understand what message do they wanted to give you, or what are the distressing things that they are going through. Acknowledging that and validating their feelings would be really really helpful. Okay, so because many a times when in the family, I've also seen many things when we start sharing, the other person try to dismiss or discount your what you were trying to say, and that becomes quite more distressing. Okay, so instead of that, listening to them, trying to understand what is going on around them and validating their feelings, validating their emotions would be a very helpful strategies that we can um, do. The other thing, I'm not very sure of the other. Is that what you have asked me or anything else? Because it was a long question, so I think I missed out a certain thing.
Ma'am, you have answered, ma'am, everything, ma'am. Almost
Oh,
everything.
okay.
Okay, thank you so much, ma'am. This was indeed quite interesting to hear once again. Ma'am, so we have another question. If someone has passed away, what could be done to make teens and children aware about the reality?
Okay.
Nitin Kumar is specifically asking about the teens and children.
Yes, that's a very, very important questions. I feel, I think this pandemic, with the lost and the grief, sometimes we feel that children are being neglected, not intentionally, not um, avoiding it directly, consciously, but even the adults do have their own grief, so sometimes handling their own grief and the handling the children becomes a very tough situation for many of the parents. Okay, so how do we handle grief, or how do we deal with the children? I think talking to children really helps. Talking and explaining to them in their own level of knowledge, explaining to them, because children might not know what death is. Many children would not have come across in their life, they would not know what death is. They might expect that the disease might come back in a few days again or so in their own pace, in their own language, explaining to them about the death, the process, and allowing them to participate in the rituals would be really helpful for children.
Okay, ma'am. Thank you so much. Ma'am, now it's the question from Neha Tagore, ma'am. Children
Okay.
grieve very differently than adults. It's not that their pain is less or they don't want to talk about it, but most of the
Yes.
times they do not know how to express what they're actually going through.
Hmm.
They do not know how to communicate or reach out for help. How can we extend help to the kids?
Yes, I think it's related to the previous question also. Yeah. So yes, children, it's very different when we talk about adult, when we talk to adult about grief and children, it's always different, you know. So sometimes what help is that, as I told you, discussing with them in their own way, how the children would understand in a very simpler way, telling them would help. And sometimes allowing them to, what we encourage them is that to write, or to draw or to sketch on the person who died, whatever they want to share a message. So sometimes that could be a ventilation session for the children itself, so these are some of the techniques that we can try out. And maybe what I will do is that I think Nimhans has developed a manual or a write-up for children. So I can share it across to Dr. Howcome, and which can be circulated around. So it would be a good reading for others too.
Okay, thank you so much for this extra effort, ma'am. We are all thankful. Ma'am, another question by an anonymous attendee. He or she feels that he. I'll read out the question. I've been feeling lonely. I know there are people who love me and are concerned for me, but this feeling of being all alone in a huge world emotionally breaks me down. What could I do to fight this loneliness?
Yes, I think as we always say, the message which has come across during this pandemic is that please stay connected. Don't isolate yourself, because sometimes in this distressing situation, when the situation around us is quite abnormal, it's always it's quite possible for us to feel down, to feel helpless, to feel uh, quite hopeless, and not feel trusting people or the things around us. So we can have lots of emotions around this period of time. So it's always good, I think. You might have someone whom you are close to, either a family or a friend or someone, or sometimes uh, religious leaders, or a counselor whom you can connect to. you know I think it's not good to be isolating oneself, but rather start with an effort to speak to someone whom you trust, whom you feel comfortable with. I think that's a way you can start initiating. And also, if you feel uh, low, if you feel down, it's always good to inform someone whom you trust, and not to deal by yourself, because when we try to deal by ourselves, sometimes we fail. We can't think of a possible solutions, and when we talk out to someone, that the other person may give us a new direction, the new way of looking at things. So it's always helpful to discuss, or to communicate with someone when we feel quite distressed or lonely.
Thank you so much, ma'am. Ma'am, another question by Vandana, ma'am. If someone creates a wall around and not willing to come out of the isolation, can you suggest ways to break it?
Okay, so this is a challenging thing for many of us. When someone is not talking to us or isolating themselves, it's very, very difficult for us to uh, to bring them uh, out from their own places. Okay, so what we usually tell is that even for us, some of the client who has come to us would not want to talk to us. We know that they are going through a lot, but they are not okay to share, or they are not okay to meet us, or not okay to seek help. So what we usually do is that we allow them, because they have every right of their privacy. We can't intrude into that. But what we usually look is at two things. One is whether he is safe. He's safe at the moment. If he's safe, we are quite, to a certain extent, okay with it. And the second thing, what how we approach is that we tend to tell them that help is available. We are there in case they would want to talk to us. They would want to share their concern. We are there, willing to support them. So this is the message that we usually give. Many a times, some of the client comes back knowing that there is a help available. They do come back. Sometimes they don't. There are times when we feel to reach out. So it's a difficult situation, but letting the person know that you're there to help them, you're concerned about them, you are there to support or to be with them, would be a message that we can give. Okay. And at times, like keeping in touch, not on an hourly basis, but on a daily basis, like just sending them notes, or trying to just check on, like if it's within the family, then have you taken meal, how have you been, or just checking on the person would really help. That might lead him or her into being able to approach you more. So these are some of the things that we can try on.
Thank you so much, ma'am. Ma'am, a question. Ma'am, some children are born disabled. Some don't have eyes, some don't have hands. What piece of advice would you give to them? They have to live their complete life with being disabled. What piece of advice would you like to give them?
See, it's advice in what sense? Can it be clearer? How do you, in what ways you want me to advise them?
Ma'am,
Can you?
ma'am, what
Uh-huh.
motivational advice, ma'am, that they would not feel disheartened or sad?
Okay. I think it's something, if it's within the family, the family accommodation plays a very, very important role there. Okay. So now we don't call them disabled. Even the new term, it's like especially able children, or they are a special child. So making them feel, acknowledging, making them feel better, encouraging them, supporting them are some of the things that we uh, need to keep doing it. And looking and working towards their talents. We have seen many people who are specially abled, but who excelled differently in different aspect. Trying to find out what their interests are, and encouraging them to work towards that, or helping them out could be one. Supporting them in every spheres of their life would be something which we can do. It's, I know I'm being very generic here, but because it's going to be a long answer to that.
Okay. Thank you so much, ma'am. So, ma'am, last question would be that how should we approach a person who has lost somebody close to them if we want to help them in such a way that they don't feel uncomfortable?
Yes. I think this is one of the myths that is going on with grief. And sometimes we don't approach the person because it's our own hesitation. So what do I say to her? How do I go and approach? So our own anxiety stops us from reaching the person who is in need of us. Okay. So I think it's always good to reach out people who are grieving. Okay. And just being there itself makes a difference, that the person knows that there is someone who is genuinely concerned about me, So that message would be, the message would be there for her, and being with her, allowing them to share their concerns, allowing them to share about their the person who has left them, okay, is another approach that we usually do while the client comes to us. So this is something which you can do, because the more you talk about it, the more you'll be able to process it. So allowing them to talk about it, and sometimes what we say to them is very, very important. You might come across telling that they might feel that it's their fault of whatever has been happened, and letting them know that sometimes we can feel that, but it's not um, the truth, or okay. So, or being just letting them know that you're sorry for their loss, or for his or her loss. So I think these kind of gestures would be really helpful.
Thank you so much, ma'am. So, ladies and gentlemen, with this we complete the question answer session. The way ma'am has answered all queries, all doubts is truly amazing, beyond measures. So now it's the
Thank
time
you.
to invite someone. I invite the event coordinator, Mr. Manish Rohela, to give a vote of thanks. Always dedicated to his commitments and duties, he's a very hardworking, intelligent, and a diligent personality. I request him to please come on the virtual podium.
Thank you so much, Madhur. I, on the behalf of the colleagues and the entire community of NSS SVC, would like to thank Dr. Kimnit busy schedule to grace this occasion and share with us her expertise on a much needed subject. Now, I would like to extend our sincere gratitude to our convener, Dr. Vanna Joshi ma'am, for moderating all the brainstorming sessions that we have had so far and supporting us all throughout the way and providing us a path to walk on. Moreover, thanks to Poonam Sood ma'am for accompanying us on the vaccination drive and supporting us throughout the vaccination campaign. Furthermore, thanks to our co-convener Haukum Wi-Fi sir for his immense support, and also it's because of him that our morale stood very high throughout. Heartfelt gratitude to Neha Dagar for familiarizing us with the activity and making us introspect and question the happenings all around with a New Year perspective. Thanks to Naveen Chaudhary sir as well for the technical support which led to a smooth conduct. A big thanks to the host of the session, Madhur, for his effortless anchoring. I would also like to thank all the volunteers who worked fingers to the bone to make this webinar happen smoothly. Last but not the least, a special thanks to all the participants who are here for asking all the great questions and making their way to the webinar. I hope very much that it has been worth it. Thank you so much.
Thank you so much, Mr. Manish. कुछ कर गुजरने के लिए मौसम नहीं मन चाहिए, कुछ कर गुजरने के लिए मौसम नहीं मन चाहिए, साधन सब जुट जाएंगे, बस एक संकल्प चाहिए, बस एक संकल्प चाहिए. तो आइए इसी संकल्प के साथ ये कार्यक्रम को खत्म करते हैं. Once again, we thank each and everyone for their kind presence and lovely participation. Thank you so much for attending.